So when you do an assessment of any fracture, so if I tell you I got pain, so for example, I'll get closer. If I say I have pain over here, you'll start, don't go right to the pain. So you would start doing your exam a little bit higher up. People, when they focus, your brain can only focus on one pain. And if this pain is rare, it's terrible, I may not feel any other pain. So when I do my exam, it's basically a palpation. And so what I do is I touch the bone, and I'm trying to stay away from, I don't go like straight there, because now I created pain and the person won't be able to concentrate. And then it says he's got pain there, I'll go on the top. And then I'll touch a little bit. What you're looking for, so imagine that this is the bone. So you see it will be solid, and then you'll feel like a crepitus. So a little bit like some, not Rice Krispies, because that would be a different thing in the skin, but you feel like a bag of beanie, you know, like it's all little balls, and it feels like it's unstable. The other thing as well, if you see obvious deformity, then you're probably there's probably a fracture. The other thing too you want to know is, so what we call proximal and distal. There's two concepts that we're going to talk about, especially when we do we call about distals and proximal. So proximal, so if my pain is here, proximal means the closest. Distals means the furthest. So proximal is the closest from my injury, and distal is further away from something. So if I have an injury over here, for example, what I'm going to check, I'm going to check the pulse. I'm going to make sure that this bone, because don't forget that on our bones, we don't have just bones and skin there. We have also vessels and everything, and bones, as you can see, are sharps. And sharp means that they can cut a vessels. And if they cut a vessels, that means my circulation can be cut. As well as that they can cut nerve. And so basically nerve is just like, just try that. Like go sit on your hand for 10 to 15 minutes. And that tingling sensation you have, this is basically your nerve and your circulation. Both can affect your fingers. And so basically this is the sensation. So you're distal from the fracture. You always want to go check if everything is intact. So the neuro, so you check, do you feel me? Do you feel me touching there? Okay. And the next one as well is the pulse. And another one that you can check, I don't know how that's going to come out, it's called a cap refill. So capillary refill. So you see, like now if I press, my thumb is white, then it comes back red, white, red, and it has to be less than 2 to 3 seconds. This one is not that important because of sometimes in the cold, in adults too, if you have bad circulation, it won't show. But you want to be sure that you have a pulse. The reason too is that, for example, if you do a pulse and then you put a splint, and especially like those splints where you're going to wrap it up, when you wrap it up, you may put so much pressure that you're compromising and because the person's going to swell as well, you're going to compromise the pulse. And so when you do this, you want to be sure that you have a pulse after you put as well this. So you have a pulse before and you have a pulse after. In your neuro exam too, you continue to check that, because if you put your strap and so you put your let's say you put your SAM splint over here, you do your full, you have a pulse, and 10-15 minutes, the person is like, oh, my fingers are just like, are numbs. Well, check that out. Maybe you just need to loosen up a little bit, because now the injury just swelled up, because it's a normal process, and because it's swollen up, now it's compromising the vessels. So that's one thing for almost all, well, for all, any type of fracture that you're going to manage. You always have to check the pulse and the neural exam before and after. If it's in the joint, again, if it's close to the joint, treat it as dislocation. And then, like I was telling, especially if you feel some crepitus, then definitely don't pull on that thing, because then now you have a fracture and a dislocation, and if you try to relocate the dislocation, you're getting into big trouble. So if it's in fracture very close from a joint, just put it in place, don't move that thing, and get out of there as much as you can, as soon as you can. Complication from fracture, and this can happen upper or lower, is what we call an open fracture. So an open fracture means that when the fracture happened, the sharpness broke the skin. And if it broke the skin, now you have a wound right where the bone is. Those ones, they're at risk for complication, because a lot of infection can get in. So that wound, not only now you have to put a splint on, but you have to irrigate the hell of that wound, just like it would be soil. This person needs antibiotic pretty soon, and when you get to the hospital or able to get to search and rescue or whatever people, you have to mention that this was an open fracture. So those people, don't push the bone back, but try to pull it a little bit so that the bone kind of goes, cover it, drain it as much as you can, and put a dressing on and try not to soil it more. And as well as those people needs to get out of there as soon as possible, so that they can be treated with antibiotic. So basically this is the main idea of fractures. So we're going to start with the head all the way up to the navel,